that I normally say the first wealth that you have is your health, because we can work hard all we want. Sometimes we're working so hard to maintain our families, to maintain our businesses, to maintain all, or our dreams and aspirations. But at the end of the day, the most important thing is your health, because like, especially if you're a woman, your family needs you to be in your best health for you to actually be able to give your best to them. You also need to be at your best if you're also looking at being there, in the best version of yourself in the next years to come. And unfortunately, because of the how things have changed in life, there's a lot of responsibilities, there's a lot of pressures in life now as well, that actually then weigh not just on everybody but women the most as well. So I'd want you to say, to especially if you're on a flight, one thing they always say is put your own oxygen mask first before you try and attempt to help somebody else. So you need to be in a position where you are able to actually be in your best position to help another person as well. So I'm just going to say, as I go through this session, I want you to just reflect. I want you to think of the people that you know. I just need to, okay. So I just want you to reflect on yourself, think about yourself, to say, what is it that I need? What is it, how does my health look like? What are the things that I haven't been paying attention to? Because sometimes, by the time we go to the doctor, by the time we go anywhere, your body has been giving you some signs for a certain period of time, but then the signs were not paid attention to, or sometimes we ignore the signs, or sometimes we just think it's small things, and we can just go through them, day by day, and just ignore it. But actually, I want you to be able to look at what exactly, does my body need? Where am I, with looking after myself? So the first thing I'm going to be talking about the first basic things, which is like the monthly periods, monthly cycles. So everything that I'm going to be talking about, it's going to cover a range from anybody that is in puberty right up to the end of menopause. So anybody that is in between that period, there's certain sections that are definitely applicable to you. So you might find that you have painful periods. You'll be having some severe menstrual cramps, and it is normal to say that if you've got blood clots, your cervix is going to have to contract to allow those clots to come out. However, there are certain things that you need to look at to say, why is it that I've got such a high level of blood clots? Why is it that because these are the things that aggravate and increase the level of the pain when one is going through their menstrual cycle. You could have very irregular periods. So irregular periods, they also apply to young people. You find that you've got some young ladies that can experience their periods where in 1 month they're spotting, the next month you have a full period, and then afterwards you've got cramps, but there's no periods, and all these other things. There's premenstrual syndrome as well. There's also what we call recurrent urinary tract infections. So there's a lot of things that then affect a lot of women on a monthly cycle, because you find that sometimes, let's say you've got a UTI, when you're on your period, it might look like it's a bit it's a bit dormant, and it's not very prevalent, for you to say, I'm feeling it so much right now. Then you think, oh, it's gone, but actually it's still there. So there's recurrent urinary tract infections. We're going to talk about continuous vaginal itchiness. So one thing also about vaginal itchiness, I remember there's a lady I met who said, I don't remember when last, I wasn't itching down there, because this is something that sometimes there's certain things that happen to us over a very long period of time. We learn to live with it, but it actually doesn't mean that, it's a small thing. Sometimes it's something that appears to be small on the outside, but it's actually a reflection of the reproductive health of your system, So there's a lot of things that are there. And, this is something that a lot of women don't talk about: sexual health challenges, the lack of interest in sex during pregnancy, after having a baby, during stressful times. And some women all the time, they just say, I know this is not my thing. I have no sexual interest whatsoever. But actually, this could also show that you actually have a hormonal imbalance. So this is something, discussions that men would normally have, but a lot of women just say, no, it's normal, for a woman not to have any interest in any sexual interactions whatsoever. There's difficulty in being aroused, which is linked to emotional health and mostly stress. And then sex not being pleasurable due to vaginal dryness. I've met a lot of women as well that say, they've got growths inside their vagina, like inside the lining actually of the cervix, where instead of them enjoying the sexual activities, they actually then feel a lot of pain, and during intercourse, and end up sometimes also this can also be due to drugs that you're taking. It can be antidepressants, it can be anti-seizures. It also, even some of the birth control pills that we take actually have an impact on things like that as well. So, these are some of the challenges that women also then get to face. And these are health challenges that are actually hormone balance related. And, you might be wondering to say, okay, but I don't have any control over my hormones. I don't have any, how do I even know that my hormones are imbalanced? Or maybe I see my menstrual cycles every month. So does that mean that my hormones are balanced? It does not necessarily mean that your hormones are balanced because you are seeing your cycles every month. There are so many ways, and so many things that can be able to cause a hormonal imbalance. So first things first, we are what we eat. We are what we eat, and we also have the impact, we also feel the impact of the things that we actually do not eat. So in the present moment, we eat a lot of processed foods, we've got a lot of sugars, because I mean, most of the time, as women, when you feel sad or you feel like you feel down, you're like, I want to have a slice of cake, I want to have some chocolate, I want to have this, and you're actually increasing the sugar levels in your body, which also then results in the subsequent increase as well of your insulin levels in your body. Now you're actually creating other issues as well within your body, as it's trying to regulate the amount of sugar that you're taking in. So there's a lot of things that actually then come into play. There's insecticides, pesticides that we use in our homes. There's also hormone-based dairy products. So these are products that we take hoping that, because it's hormone-based, maybe it's going to assist with certain things, but there's actually also other things that also then come into play. So you find that alcohol and high consumption of alcohol and caffeine also results in hormonal imbalances, and sometimes what we apply on our bodies as well, like there's so many anti-aging products that we use, trying to maintain that skin, trying to look younger, trying to look, the maybe 10 years younger, the version of yourself that you want, that you probably liked. But there are so many ways as well, for us to maintain that look over the years. And you'll find that some of the skin products, the makeup and the hair products, perfumes, even some of the cleaning products that we use, they've got what we call venoestrogens. So you don't have to remember this, but they've got what we call venoestrogens that actually mimic your hormones. So it will not be the real hormone, but it's mimicking your hormones in your body. And then that also then results in a regulation activity where your body is now trying to regulate those hormones, but it's actually toxins that are mimicking the normal hormones that you'd have. So that is how you then find to say, no, after a few weeks, I was looking younger, I was doing this. It's not a skin rejuvenation. It's actually hormones that you're taking in. And hormones, it normally takes about 26 seconds for them to be absorbed into your skin. So these are some of the things that we are exposed to knowingly or sometimes completely unknowingly, So, there's also what we call toxic overloads in our bodies. And, in conditions like pregnancy, breastfeeding, menopause, it also affects your hormonal balance. And then you end up having the hormonal imbalance that we're talking about. And, I also refer to pharmaceutical drugs and other diseases like thyroid diseases, like overweight, obesity, and stress. So stress obviously plays a lot, especially when it comes to there's certain hormones that your brain releases whenever you're under stress, like the same way you have the flight, hormones that you also get to say, okay, I need to run, I need to do this, so your body will also be trying to keep you in that state, for you to be able to say that I'm in a calm state. But then with it doing that, it actually then also results in the hormonal imbalances that we experience. So what are the symptoms of hormonal imbalance? What is it that you could say, how do I identify that I could have a hormonal imbalance? So it could be mood swings, low libido, this is just low sex drive. It could be headaches, constant headaches. There's also night sweats. Sometimes you get to see someone saying, no, I actually experience a lot of night sweats, but it's not menopause, it's actually just night sweats. So there's also food cravings. There's some chronic food cravings that you get to a point where you feel like, okay, I constantly want to have this, I constantly want to eat this certain amount of food, I want to eat this, I want to eat that, but it's actually due to your hormonal imbalances as well. So you find that acne, tiredness, and also if you see yourself gaining so much weight, but you're actually not eating much. So you see that there are some people that will say to you, I don't even understand how I'm gaining so much weight because I don't eat much. But it's the hormonal imbalance that is actually not allowing your body to be able to use what it needs to use, and instead it's harboring everything as if it's in a starvation mode, and storing everything that you take in, no matter how minute the amount of food that you're eating. So one of the things that actually is very close to my heart is that in my family, in my mother's on my mother's side, there's a lot of people that have suffered from breast cancer, and sometimes we wonder to say, how then do I know? So one thing I would say, the most important thing is every single day, or at least once a week, always make sure that you check your breasts to make sure that there are no lumps. This you do it by stretching out your hand completely and try to make sure that even your breasts are spread to against your chest for you to be able to check for lumps. So it does not necessarily mean as well that if you do find a lump, then you've got cancer. No, that's not. It's not like that. Sometimes it can be just a lump, or it can just be a lump that is resulting from the nodules within your breast that normally would store and transport milk. So those tubes sometimes can result, in having some small lumps that are in there, but then it does not necessarily mean that it's breast cancer. But anyway, it's always good to check and then go to the doctor. If you feel anything, or if you feel anything that is unusual, then you go to the doctor to get checked. So you find that breast cancer is also one of the results from hormonal imbalances. So this is where we're saying that 20% of the breast cancer cases are genetic. This is where you've inherited it from birth, from your line of the genes that you took from your parents, your parents' parents. Those are things that are inherited. So 20% is due to inherited genes. And then 80% due to, poor diet, exposure to toxins in the environment, and pollutants that can tip the balance over to make your cells actually convert to becoming cancerous. And then you'll find that, but 97% is due to estrogen imbalance. So for me, this is what then also highlights the fact that as women, it's really important to try and make sure that, we have our hormones, in a balanced manner. We look after ourselves. And this is, through what you eat, what you drink, it plays a role. So you also find that when you've got high levels of estrogen, fat cells are also estrogen making machines. So that means the more you gain weight, the more you are actually increasing your estrogen levels in your body. This is where you find that sometimes the doctor says, if you want to have a child, you might need to shed off a bit of weight. What they're just trying to say is you need to lose a bit of weight to allow your body to have a balance within your hormones, for your hormones to be balanced enough to make you, have a fertile environment within your pelvis. So these are some of the things, the risk factors that come with hormonal imbalance, right? So you also see that there's a lot of things, how you might be saying, okay, so what do I need to do if I'm seeing that, these are some of the things I'm identifying with myself, like, high levels of acne. So a clear example, when a lady is going through puberty, because of that change in your hormones, you would normally find that at that stage they've got high levels of acne. But once their menstrual cycle starts, then it actually starts clearing, everything starts going accordingly. And so now you then find that sometimes, even at a very later stage, where you're actually now just a full-blown woman, you still have those acne issues, you still have those skin toxin issues and all these other things. Most of the times it's hormones. If you're struggling to lose weight, it's your digestive system, its status, as well as your hormones. So these are some of the things that you can then be able to say, okay, I see that, but what am I then supposed to do? So one thing first is that you definitely need to try and make sure that you remain active. So when I'm saying remain active, I'm not saying go to the gym every day, or you need to go and do hardcore exercises. No, that's not what I'm saying. But I'm saying you need to try and make sure that at least 4 times a week, you find something that you can do. It can either be skipping, it can either be walking, or if you can go to the gym, go to the gym. If you can have a few friends that you can walk around your area with, then you can do that. that actually then allows your body to not just only lose, but to maintain as well, the cardio health of your body, as well as, for you to be able to lose. If you're going to shed off some weight, then you can be able to shed off some weight and actually maintain it. And it also allows you to break down most of the fat cells that are in your body, which are then as a result also produce the high levels of estrogen. So you also need to drink milk that is high in vitamin D. There's also coconut oil. There's omega-3 fatty acids that you can also get, and also try and sleep better. Especially if you're not sleeping for at least 8 hours a day, try and create a sleeping pattern to say every day I need to try and at least sleep before 11 or whatever time that it is, because your sleep patterns also then determine how long your brain has to shut down, and that also it reduces your anxiety levels, your stress levels, and overall it actually gives your body the rest that it requires as well. So you find that 70 to 80% of women suffer from fibroids before the age of 50. So what does this mean? It means 8 out of 10 women will suffer from fibroids at some point in their lives. And this is now more prevalent now because we are in an era where years and many years ago, women used to start having kids very early. Around 2019, they've already started having kids. And because of that, it didn't give the body room to actually keep producing eggs, that are going to not be fertilized. And then this now then increases the chances of, fibroids. There's also delayed sexual activity in women, and yet our bodies are actually getting older faster than we actually are. So you find that most of the time when you go for a medical analysis, they can say, oh, we can see that you filled in your forms to say that, let's say you're 35, but your body metabolism is actually at the age of 40. So there are so many things that come into play, when it comes to fibroids, and it's mostly also due to hormonal imbalances. So fibroids, obviously, they're also different from one person to the other. Sonto, please, can you mute yourself? I'm sorry, I'm sharing my screen.
Sorry.
Oh, thank you. So you find that fibroids differ from one person to the other. They can be as tiny as, like a few millimeters to as big as an unborn baby. So obviously, depending with where it has been lodged, if it's a small one that is lodged within your, your pelvic area, you might feel some discomfort during sexual activity. You might feel, some pain and some discomforts here and there. But you find that maybe if it is lodged, depending on where it is lodged itself, sometimes fibroids then also cause things like infertility, right? So there are so many things that happen. There's so many aspects to it that actually then result to what you're seeing on the screen right now. And obviously, depending with the size of the fibroids, it also then determines whether one is going to need to actually go for surgery immediately, or what happens, what's the medical course of action that you're going to receive. So I'm going to explain more about the ovarian cysts and how everything is linked to the hormones. So on the left, you're going to see that that's a healthy ovary. And then on the right, I'm showing an inflamed, a bigger size of an ovarian cyst. And what it just means is that, I want to look for, okay, this is fine. So you'll find that, for example, when on a monthly basis, your body then produces a what we call a follicle that then matures to become the ovulated egg that is going to come out. You call it an oocyte, right? So when the follicle is developed and then it matures over the month, and then it comes the time where you're going to ovulate, and then towards your menstrual cycle, it is then dislodged for it to come out. When someone has got what we call polycystic ovary syndrome, your body keeps producing these follicles that do not fully mature for them to be released out. So this is when it then ends up looking like this, because it has accumulated so many follicles inside that you then get to a point where they say, no, we need to remove the entire ovary, or we need to, depending with the condition and the state at which it is now at. So this shows that, sometimes we feel certain pains, and normally when you have this, you might actually think that it's just a small pain that is resulting from, an egg being released in one of your ovaries for that particular month, or, but once you see that something is persistent, it is better to make sure that you get it checked out. So this is also another reason why it's really important to try and make sure that, what is it that we do to try and maintain our reproductive system, because that is what makes us women. That is what gives us the abilities that we have that are actually solely very different from men. And you find that also our reproductive system goes through a lot, especially after child delivery, because your body basically does not remain the same, because it has gone through a lot of trauma, a lot of, for you to actually be able to have the baby in you for 9 months, it takes a lot from your body. So you need to then make sure that even if maybe before childbirth you didn't have any issues whatsoever, after childbirth you'd actually now need to pay attention to your body to try and see, to say, what is it that I can do, to make sure that I look after myself? What is it that I can do to look after my health? So there's what we call polycystic ovary syndrome, which is what I was explaining, and it's normally genetic, hormonal, or due to your metabolism, as well as reproductive disorders. So this normally affects 1 in 10 women, and you find that 50% of the women, normally it goes undiagnosed. Right? So there's a lot of things that, we need to be able to look at. And one of the common signs is the irregular periods, anxiety and depressions. Every time if you feel that you've got high anxiety levels, this is where you see, let's say, like your phone, you receive a text message. Before you even see what is there, you are already very anxious. You start feeling like you've got a bit of fear. That actually shows you that your body has actually took a turn, and you now have high levels of anxiety. There's also depression. Depression is something that is very real. It's not just a state of mind issue. It actually does have, issues on your metabolism. It has issues when it comes to your entire body. So it's not just a mental disorder to say that, because sometimes, when a lot of people say, I'm depressed, everybody just says, no, take some time off, just, relax, do this. But actually, it does require medical attention. So the other symptoms could be infertility, outrageous weight gain. This is where I was explaining that the amount of food you eat and your diet does not relate to the weight that you are gaining, right? So heart, okay.
I can't listen to this.
Okay, let me just try and mute.
Huh? Oh, mar onore wa di-pancakes. It's a winner.
Okay. So you find that, like what I was sharing, that the polycystic ovary syndrome, it affects a lot of women, but the most important thing is to say what you can do is to try and, play around and ensure that you research more, you look into your nutrition, look into what you take into your body on a daily basis, pay more attention to yourself, pay more attention. So you find that a lot of times, we go through a lot of symptoms that we actually don't pay attention to, and then it actually then results in something else that is bigger. But by then, if it had been detected in the early stages, it would have been actually much more treatable, and there are certain things, just like the discharge that comes out, on a daily basis, you're able to track and see the changes in your discharge that will actually tell you the health, status of your reproductive system as well. So you find that most of us, we actually take birth control pills. So you find that birth control pills, unfortunately, they also contribute to a lot of nutrient deficiencies. They often cause moods as well. And that moods is because of the changes of your hormones between anxiety and depression as well. And sometimes they also worsen things like yeast infections and candida, right? So this is where you find that someone is constantly prone to yeast infections, whether it is because you took maybe too many baths in the bathtub and you sat, and then in the bath now you've got a yeast infection, or you sit on an unfamiliar toilet, now you've got yeast infection, or simple things, small things, or maybe your underwear was not that dry when you decided to wear it, already you have a yeast infection. That the rate at which you are prone to getting things like that actually then influences and actually shows that the health, the reproductive system itself is not in a healthy state. because that is the reason why it is so easy for bacteria to lodge itself in there and actually multiply on a continuous basis, you know. So you also find that birth controls also have issues because they increase your chances of getting blood clots. So blood clots, this is where you find that, I don't know if any one of us, you can just write in the chat, you know, if you say, I actually have taken medication without looking at the side effects. Because I know that sometimes, you know, we are just looking at the issue where we say, okay, this is what I need to be healed of right now, but we actually don't really, you know, go through the leaflet that comes with the medication for us to see, to say, what is it that I'm taking, what are the components, you know. So if you can relate to what I'm saying, you can just put you know, a word in the chat, you know, to say that I actually, because most of us sometimes, you know, it's normal, you know, you're let's say you've got a headache, you're in pain, and you decide to say, I want to take these painkillers, I want to do this, I want to do that. You actually don't really get a chance for you to then look and say, what does this mean for me, you know. So this is the same as birth control pills. It's something that we need, but we also have to manage it, because it also leads to the high risk of women suffering from cardiovascular diseases. So that is actually a high risk in women due to birth control pills. But at the same time, you need to take the birth control pills, because if you don't, then you get pregnant, you know, if you're of that age. And sometimes people take birth control pills to actually regulate their periods because they are currently irregular. So you are then given the birth control pills to try and regulate your periods. So this is something that, you know, we understand that as a woman we go through a lot of things. We actually have a lot of things that we have to manage, but unfortunately we actually now also have to look at the extra to say, okay, I know that I'm taking this, so what is it that I can do to manage these effects that I'm aware of, you know. So there's also what we call you know, the urinary tract infection. So a lot of women talk about this, and sometimes people even confuse this with STIs. It's not a sexually transmitted infection. It would be a urinary tract infection that has lodged itself in your bladder. So when we're saying inflammation, we actually, if you see here, let me just go back, there is the red, you know, inflammation that is showing, that red color that is showing there, that is what we call inflammation. So inflammation is when your body, it actually also comes with a bit of swelling. It's when your body is trying to fight off certain diseases, you know, to say, it's like when you have a flu, it lodges in your chest. So your body naturally produces a lot of mucus to try and control that infection, and for you to actually then blow your nose and get it out, right? So same thing happens within your body. Like even when you get a mosquito bite, that redness that you get, it's actually the body deciding to say, we're going to lodge more T cells in this section of the body because we need it to heal. So, you know, you need to actually then be in a position to say, I need to help my body. You know, I need to help my body to be able to get to a point where, you know, it's functioning well. You know, just the same way we take our cars in for servicing, and you know that, okay, even if your car is in a good state, if you drive it for, you know, so many kilometers without taking it to the mechanic, it's going to start giving you problems. If you continue driving it in that state, then it's going to give you bigger problems that are actually going to cost you more. So same thing with our bodies. It's just that, you know, our bodies were given that ability to try and, you know, get back into the state that it is supposed to be, to heal themselves. But there's only so much that the body can do. One thing you also realize is that even that I actually forgot to mention, when we take birth control pills, most of the women that take birth control pills, you can see, because the underarms, they become so big and heavy, you know, like when you're waving, you can actually feel your underarm shaking underneath. That actually shows you it's the amount of the hormonal imbalance that is created that then makes you gain weight in certain areas of your body. That's how you get the, you know, the visceral fat around your stomach, and then all these other things that come into play. And the reason why it also then leads to things like cardiovascular diseases is because, remember, the size of your organs does not change. So because the size of your heart does not change, and it is continuously having to pump blood to supply oxygen to every single cell in your body, it actually then strains it. This is where you see that maybe, you know, like when you're of a smaller size, when you're sleeping, you breathe better. And then with the bigger you get, the more you're breathing loudly when you're sleeping, and people can hear that, okay, she's now sleeping. But it's actually not to say that there's anything wrong, with you or anything. It's just that your body needs a bigger amount of oxygen, like more oxygen to be supplied to all your body cells. And then the strain comes in, so this is where, some of the things that are actually really close to my heart, because when I was young, my mother used to say, I've got these terrible headaches, I've got these terrible headaches, but she never got it checked out. So she would just, take some painkillers, send me to the tuck shop, get some painkillers, and then that is it. But it came on one day where we actually then realized that, it wasn't a natural headache. And then, but by the time that came to happen, it was actually far within the issue that she then passed away. So it made me realize that sometimes, as women, we are so busy, we're looking after each and every person around us. We're trying to do the most. Like a woman is every child's hero. You not even just children, your sisters, your brothers, everybody knows that normally if you go to a woman and say, I need help, she's going to move hell and water to try and assist you. So we then don't have, time to have that same energy for ourselves, because we're so busy. You wake up in the morning, you remember to take your birth control pills. After that, you don't remember that you need to take more than 2 liters of water. You are now making breakfast. After that, if you've got kids, they need to go to school. They need to get picked up. You need to go to work. You need to keep your boss happy. You don't have time to even understand that I'm now tired. And this is what I need. I need to relax. I need to, your emotional health also plays a lot, because remember I said that your stress levels can also contribute to hormonal imbalance. And as women, it's just unfortunate because our hormonal imbalance plays a lot, within our health system. So you find that when it comes to UTIs, there's a lot that is there. So this is where I'm showing in green. This is where the bacteria decides to say, I'm coming in, it lodges itself. And, the one thing that we need to make sure is that we have, a certain routine in our lives that actually make sure that our bladders and our organs are in a very good state. So because what happens is that even sometimes when you come in contact with bacteria, if your immune system is so good, you will not be very quick to actually catch that bacteria and that bacteria to lodge itself in your body. This is where you find that two people of the same age, of the same everything, they can be exposed to somebody that has flu, but then only one catches flu, the other one doesn't. They can sneeze for like a day, but tomorrow, if the other one wakes up with full-blown influenza, the other one doesn't have. It's because of the state of your immune system and how quick it can fight certain things like this, right? So about 1 in 4 women are likely to have a recurrent UTI. So you will need to know that when one has, a UTI, a urinary tract infection, you will need antibiotics, right, to clear that out. So one thing that is also there, when one takes antibiotics, so from my background as a biochemist, I'll say when antibiotics are produced, there's a certain level of a period that we expect that the patient is going to take the antibiotics. So if the antibiotics have been prescribed to say you're going to take for 10 days, for instance, then you take on day 1 because it's still very bad. Day 2, day 3. Now day 3, you've got no pain, no effects, nothing. Normally, then you don't finish the course. You stop taking the antibiotics on day 4. What it means is that you did not fully treat the infection. The infection is there, but it has been weakened by the antibiotics. But what it results in is that the antibiotic that you used to try and clear out that infection, it has been exposed to the bacteria, but because the bacteria survived and it is still there, but just not, as powerful as it was, it mutates. We call it a mutation where it actually becomes, let's say, immune to that particular antibiotic. So what it means is that should you get that urinary tract infection again, those antibiotics might not work. So now it also means that now you're making yourself a bit more prone to more UTI infections, because this is where you didn't manage to finish the antibiotics and now you keep on having to change. And now when the doctor then says, what, the last time this is what I gave you, so now let me give you a different antibiotic, you are actually exposing your body to too many antibiotics. And we all know that as a woman, we've got normal bacteria that is in our reproductive system that helps us to clean. That's why there's a discharge that comes out, that cleans your reproductive system. So now when you're taking those antibiotics as well, they kill the natural bacteria, that we call it flora, that is inside your reproductive system. So you see that this is where we're actually now creating another problem for ourselves. So this is where we need to understand that whenever one has any issues that are especially related to any system, like it could be your digestive system, the reproductive system is actually much more trickier. So you find that if a symptom is not treated completely or properly, when it comes back as if it's for vengeance, because it comes back stronger. Right? So this is where you find someone saying, I had a yeast infection, but this time it's so bad. It's not as what it was the last time. It's because the yeast infection had time to actually mutate and find ways to survive, such that even when you're taking the same antibiotic, it's actually not helping you as fast as it should because of the previous infections. So I'll go to the pelvic inflammatory disease. We call it PID. So inflammatory, like I was explaining, this is just, like a sense of swelling or redness, where your body is trying to fight off a certain disease or a certain infection. So that's what inflammatory disease just refers to. So in this case, we're just looking at the pelvic system as a whole, right? So this is when bacteria enters your fallopian tubes. The fallopian tubes are the ones that lead to your ovaries, right? From the uterus, so the hanging ones. So this is when bacteria enters into your fallopian tubes, and then sometimes it may just stay within your uterus, which is the area where there's from, I'm trying to point here, but it's not giving me a mouse. But anyway, you find that where there's number 2, where number 2 is pointing at, that's your cervix, leading into your uterus up here. So you find that the tubes that are hanging on the sides, that's your fallopian tubes, and then you've got your ovaries, which are the white circular eggs that are there. So you find that an infection in the pelvic area, the treatment will definitely be different depending with, if someone has an inflammation that is at number 2, which is within your cervix, that's not as bad as someone that has an infection that is in the ovary. I'm sure you understand why, because the distance at which the bacteria has managed to actually travel in your body is more, right? So there's a lot of things that are there. So this is where you understand that the women's health is really important. So you might be asking yourself to say, how does this happen? So on the left, you've got a healthy female reproductive system, showing the vaginal canal, everything properly, the ovaries, everything. Then you've got the reproductive system that has the inflammation. This is where you find abscess. So for you to know that this is a certain symptom that is probably identified with myself, it's when you find that your discharge is dark brown, and it's not, dark brown soon after your period. It's normal for the first day after your period. But let's say any other time during the month, you find that your discharge has got a bad smell, or it's turning green. So as long as your discharge is not white and slightly sticky, then that means that, this is not, there could be something that you need to look into, So there's a lot of things that one has to really understand, that there is so much that one can do. And, the reason why I'm actually deciding, to share this is because, as a biochemist, sometimes I've worked in production as well. There are so many things that we know, and, people need to understand that it's a business. And because it's a business, it means you need to maintain a customer. So whenever one takes certain antibiotics, you're actually also receiving another issue that you might have to deal with in the future. So these are certain things where, I appreciate that years ago, like when the other, older people that lived, they used to try and eat natural foods. They had their own gardens. They even used to use wild leaves, mostly for tea and things like that. Those things used to actually detox and completely cleanse the body. So now this is unfortunately, because now in the times that we live in, people do not socially accept to say that somebody came and gave me, let's say, moringa. I'm going to use moringa as a very good example because it's got a lot of elements that help with the heart. If someone says, I brought you moringa leaves to actually help, with the issue that you told me, let's say you've got a cardiovascular issue, it's more socially acceptable for somebody to bring you pills. So people will definitely take that more. So you need to try and make sure that you look into your nutrition more. You need to look into the things that you have around you, to be able to actually see, to say, what is it that I can use to maintain my health? I'm not saying it's wrong to take pharmaceuticals. It is. You definitely need pharmaceuticals. You definitely need to be in conversation with your doctors. What I'm saying is that you need to try and avoid to get your body getting to a state where you actually now need serious medical attention. Right? So the pelvic inflammatory disease, this is where, you sometimes feel lower abdomen or pelvic pain, where you're holding or you're trying to press in your lower abdomen and then you start feeling pains. And then also there's a heavy vaginal discharge. It could be yellowish or greenish with a bad smell. And then there's irregular periods, pain during intercourse, fevers, fatigue, constantly feeling tired, painful when urinating, lower back pains. And, this could also be sometimes also if it is also a severe PID issue, then you could also suffer from things like fallopian tubes blockage, which could also then lead to infertility. So we'll also then talk about menopause. So when I'm talking about menopause, I'm not just talking to people that are above the age of 35 or 40, because there's also what we call perimenopausal systems, where people start suffering from menopause effects 10 years before the menopause actually occurs. So, this shows that your body is actually struggling to regulate your hormones. This is where you're now already experiencing irregular periods, hot flashes, vaginal dryness, and night sweats, loss of libido and sexual drive, itchy skin, and especially if you see that every time you constantly feel itchy, these are some of the things, that one will have to look at. So there are so many things that are there that one has to look at. So it is okay, menopause is part of the cycle that women have to go through, because the same way we all go through puberty, we all go through the fertility period where you're having your children, same thing, your body is now changing, going into menopause. It does not necessarily mean that, for the bigger time of that, you now have to suffer from things like that. So this is why you find also, because of our diet, our great-grandparents could have kids at the age of 40, 50. They had kids like 8, 9 kids. Now, at the age of 35, one is normally struggling to have children. Right? This is because of, remember I said, we are what we eat and what we do not eat as well, or, what we do not supplement within our bodies. So there's a lot of things that are there. There's also what we call non-communicable diseases. So I'm not just saying that, it's just the weight issues, the hormones issues. Weight is actually really important in women. That's why I was saying that, because the more you gain weight, your fat cells actually produce estrogen, which results in a hormonal imbalance. And normally it actually results in a bigger, development of fat cells around your stomach and your underarms, right? So there's also non-communicable diseases. These include the cancers, malnutritions, respiratory diseases, cardiovascular diseases. So we've slightly covered cardiovascular. Mental health, this is just your mental health, your being, what is it that you're doing that actually calms you? What is it that that's how I was saying that, if you decide to remain active at least 4 times a week, then this is also going to help you with your mental health. So diabetes is one of the issues that also come up with high blood pressure. So high blood pressure, this is when, your heart is pumping more than it can. And then you find that the rate at which, you're requiring blood within your cells is actually more. And because of that, your heart starts pumping harder. And because it's pumping harder, that's when we say someone has high blood pressure, because we are feeling that strenuous effect. Then also, you find that when your sugar levels are not regulated properly by your body, then you start producing irregular levels of insulin, which also results in weight gain, affect eyesight, they affect your joints and things like that. So it's also one of those things. You might actually be someone that already has diabetes or already has high blood pressure, but I want you to take note that it used to be something that one can only think about at the age of 50, 60 to say, oh yeah, they now have diabetes. But nowadays we've got 20-year-olds that have diabetes, that have blood pressure issues. Myself, I'm 29, and at the age of 27, I found myself now dealing with issues of high blood pressure that could also lead to diabetes because of the weight that I had gained. So this is something that we all need to be aware of. These are some of the things that we need to look into, to be able to say, okay, so how best can I help my body for me to be able to maintain a state of health that actually helps me. I'm not saying you'll be able to eliminate everything, but the least that you can do is to try and make sure that whatever it is that you're doing something that actually adds value towards your health. Right? So there are so many other cancers, of course. We just spoke about breast cancer. There's also cervical cancer, which is one of the most leading cancers in women. And you find that, balancing your hormones actually reduces the risks of you getting breast and cervical cancer. And it's also advisable for you to make sure that you go and get tested for cancer at least once a year, or, at whatever frequency that you can, but at least try and go. If you haven't done it before, try and make sure that you book an appointment with your doctor or your gynae and be able to get checked for this. Because one thing that is there is that I know that sometimes there's the fear to say, what if they find something, then what happens to me? It's better found at earlier stages than later, when it's actually much more complicated or bigger, or maybe it actually now requires surgical interventions or things like that. So what are the main challenges, that cause hormonal imbalances? We've got lack of proper nutrition, toxic overload, and free radical damages. So you might be wondering to say, okay, free radicals. Free radicals are, there are some that are produced by your body, which is natural, but there are some that then come from the food and the environment that we're in. So you'll find that, for example, if any one of you guys have ever gone for an X-ray, you see that the people that take you in, they have to wear aluminum coats to try and protect themselves from those rays, because they actually result in the production of free radicals in your body as well, which also results in the change of normal body cells to becoming cancerous. So especially if you've got high levels of that. So these are things that one can be tested for. So you'll find that there's normal antioxidants that are produced in the body that try and neutralize these free radicals in the body, because the free radicals, they come and attack healthy cells, right? So you'll find that free radical production that is in your body it can come from alcohol. So I'm not saying alcohol consumption is bad, but the excessive consumption of alcohol. Plus also you'll find that there's certain things that you get, things like red wine. A glass of red wine does assist to try and reduce cancerous cells as well in the body of a female. However, everything has to be done within regulation. So you find that physical stress, a metabolism that is not clean. And when I'm saying a metabolism, your digestive system, if it is not clean, like how everybody needs to make sure that they clean their digestive system at least twice a year. But normally people don't do this. So they just think if you drink water, then you're going to clean your digestive system. So if anyone has ever eaten tripe, and you think about it to say everybody has the same height. Your height is equivalent to the intestines that you have inside your body. So if you take a glass of water, or let's say you're currently drinking just 2 liters, you pour 2 liters of water from one end of the intestines to the end. This is a question to the floor to everybody. Do you believe that 2 liters of water is going to clean out all the dirt in your system? So these are some of the questions that we need to ask ourselves. That is this enough to clean my system? And you'll find that there's also things like the car exhausts, there's emotional stress, there's processed foods, ozone layers, all these other things, smoking. And sometimes you might not even be the one that's smoking, but we come across people that are smoking around us. There's obesity. This obesity is when obesity does not mean that it's someone that you look at them and you see that this person is of a big size. No. Obesity means, if any one of you guys actually wants assistance for us to calculate your BMI, you can let me know. But what it means is that your height and your body fat, as well as your protein levels, should be equivalent. It shouldn't be more than the other. So you might find that someone that is extremely short, being 70 kilos, is overweight. Because for their height, it is not proportion. It's not proportional to the organ size that we are estimating that they have, right? So that automatically then makes you to say that, okay, this person is currently falling on the obesity side, and it actually also makes your body to age faster. This is why you see that when somebody loses weight, when they show before and after pictures, they look younger when they lose weight. This is because your hormones are also now balancing. Your hormones also have an effect on the outlook of your skin, and also the moment you get rid of toxins, and cleaning your digestive system, it means that when you're actually taking in good food, good supplements, body supplements, your digestive system is clean enough to absorb the nutrients that you're trying to give it. So there's a lot of things that are there, and also the process of detoxification and elimination. Your body naturally tries to detox itself, right? So you find that your lungs will try and remove the carbon monoxide and from your body that is coming from the smokes. Your skin tries to take out toxins. Sometimes that's why you find somebody can have pimples that look like they are erupting, like they look really horrendous. That is your body trying to eliminate toxins as well. Your gut obviously will try and take that out, and through your liver will take everything out through the skin, kidneys, colon, your lungs. The rest of the toxins are stored in your joints, your blood, your tissues, and your muscles, right? So this is where you find that the more you're actually also then having these toxins, now you have acne and skin breakouts, high levels of allergies, arthritis, and joint pains. Normally, it always starts on the knees and hips, and things like that, autoimmune disorders, headaches, or high levels of obesity, overweight, and inflammatory issues, hormonal imbalances, all those things. So for ladies, the minimum amount of water you need to drink is about 2.7 liters. This also depends with your current weight, and the bigger you are, the more water you actually need to drink, right? So, and then for gentlemen, that would be about 3 liters to 3.7. And this is just an illustration where I want to show that sometimes we have, when our cells are going through what we call oxidative stress. This is where your cells are not receiving the nutrients that they require. This is an apple that has been cut into half to oxidize, within the natural environment, and then that is how it looks like. So the same thing happens, but if you actually decide to take, an orange has got high levels of vitamin C, and you rub vitamin C on the orange, it does not age that quickly, right? So these are some of the things, the effects of what we call the free radicals in the system. And these are things, normally the free radicals are things that are not even listed on the contents page of or the labels of the food that we take in, because normally they'll just write carbohydrates, fats, sugar, salt, if there's any, then the rest is allergens, right? So these are some of the things that we need to know that they're getting into our body. We've got a broad spectrum of nutrition, so what it means is that the human body heals itself, and nutrition provides the resources for the body to accomplish that task. So this is something that was actually written by a PhD holder, Dr. Roger, where he studied nutrition against diseases in 1971. So he established that everything that you take in actually helps the body to heal itself. So your job is to say that I'm going to take a certain level of fruits, I'm going to take a certain level of vegetables, I'm going to do this, and your body then uses that which you give it to heal itself. So this is where you find that somebody says, I had a small fibroid, I changed my diet, the fibroid is decreasing in size, they've said I don't need surgery anymore. So this is why I was saying that sometimes it's better to detect things at an earlier stage, because then they are still within a certain level of your control to try and allow your body to heal itself, So obviously the other issue that we have is that there are very few people that have their own gardens. Very few people that have their own gardens. So what it means is that even if you are buying food, right? The food that you're purchasing, you have no idea whether it has high levels of toxins or not, because as the commercial farmer, all they want is to make sure that the apple that I'm going to supply has to be the most green and shiny one in the market. So what is it that I need to do for me to get that outcome? So already that is not a natural, a fruit that you're going to get. So what it means is that sometimes we actually purchase some of the things that we think are going to help us, but they are actually loaded with toxins as well. This comes with the fertilizers, the certain supplements that they give to plants to make them come out a certain way. There's certain genetic manipulations that occur for you to actually produce a certain type of vegetable, a certain type of fruit, or maybe a bigger chicken, that can be worth more, so that you can be able to say, I'm going to have bigger chickens that I'm going to sell. How many of you have actually bought a packet of chicken and one day you find to see that, no, this drumstick does not look like a normal chicken. We have such a big drumstick like this. This is something that we see every day, but it's something that we don't have control over. So people are fed by the food industry, which pays no attention to health. At the same time, they're treated by the health industry, which also pays no attention to the food that the people are taking. Right? So you find that most of the time when you actually go to the doctor is exposed to extreme conditions. They've got so many patients. They're not going to take so much time into trying to understand what is it that you're eating, where do you buy it, what are you doing. They just then only have time to prescribe, So there's a lot of things that we do. So that means we now need to look into our nutrition, and we now need to look into supplementation. We now need to look into what is it that we take. So Dr. Walter said, from Harvard School of Public Health, said that a recommendation for dietary supplements should be included as part of a healthy diet. So what it means is that you need to understand that there's certain essentials that you might not get, from the daily amount of food that you eat, from the things that you take in. So this is where you see a lot of people, sometimes, you see them on social media, they look amazing, their skin, their body. Those people are actually taking certain health supplements for their bodies. They're not just going to the gym and say, oh, I'm just trying to lose weight, I'm trying to do this. There's actually more, because if somebody decides to say, I'm going to take something that cleans my colon, I'm going to eat well, I'm going to go to the gym, that is how they give drastic, unrealistic results, where you get to see a lot. And then when you try and do it, you don't get the same results. It's because what you take in actually has an effect on the overall outcome of your body. Right? So I then decided to say, from growing up, my mother used to give me aloe vera to drink. And that was because, we came from a very poor background. There was no medical aid. There was nothing. So where she grew up, like in the rural areas in Makai, they used to harvest aloe vera to say, this is what you need to drink. And, all I knew is that it was a punishment. And I used to try and say, but I ate my veggies. Why am I drinking this? But I did this. I tried to justify why I shouldn't. But when I got to grow and become older, I found myself actually looking for it, because I knew that I needed it, and I knew the impact that it had. And fortunately, at this particular point in my life, this is where I was now also in a position to actually conduct the research and be able to understand, to say, what was the impact of the aloe vera within the body, what is it, and especially if it's aloe vera barbadensis, to try and see what does this species actually do with the human body, what are the advantages, health advantages that it has. So I then decided to say that, I'm going to look into these, try out some for myself, which is the reason why I'm actually now sharing it with you today. So the company is international. It is certified by so many boards, halal, all these other boards that are there. So, and the reason why I'm actually sharing this is because when it comes to your health, you can't take anything lightly. You need to look into the fine print. You need to look into each and every single thing that you're taking into your body. You need to be able to be in a position to know that you're only doing the best. So anything less than the best would not do, because we only have one body that we need, that we're going to have for this particular life and the rest of our lives. You only get one chance to look after your body. You don't get, extra organs or anything else above and beyond what we currently have that you're born with. So this is the reason why I then decided to actually look more into it and look at the certifications, look at the research, look at the species that they've decided to use, look at everything like that. So you find that Forever Living is committed to bringing products that are with high standards, in the world, and obviously seek out they've got the certifications that they have, which is due to the checks that are there. So one thing I'm going to say is that from everything that I've shared so far, I've spoken about the diet that you need to have, natural food that you need to have. I've spoken about dietary supplements. I've spoken about time for yourself. I've spoken about your mental health. I've spoken about, reproductive health as a woman. So what I'm not, as even from the beginning when I was saying I'm not a doctor, I'm a biochemist by profession. And I'm not saying that this should rule out any pharmaceuticals whatsoever, because one thing that you realize is that the pharmaceuticals that we take are targeted to what we call enzyme activity in your body. So it's targeted, it's a cell-based target type of medication. So you will always need your pharmaceuticals. But what I'm saying here and what I'm about to show you, it's things that can be able to assist your body to maintain and actually be able to get into a state of self-healing, right? So it is what is going to allow your body to, it's food with supplementary effects and dietary advantages. So this is not medicine. We're not talking about cures. We're not talking about treating. Where I'm not showing things that are going to mitigate any particular disease or things like that. But I want you to understand that these are supplements. It's dietary supplements that you actually need to take together with your food, depending with where you're at within your health spectrum. So not everything applies to everyone, but certain things will apply to certain individuals, personally, as you look at yourself. So you find that these are my favorite that I also use on a daily basis myself. So I actually start every day in the morning with the aloe vera gel, which is the yellow one. So the aloe vera gel cleanses your gut. So remember, I gave an example. I said for those that eat tripe, if you take 2 liters of water and you pour it, and you pour it at the right at the end, or at the beginning of the tripe, and you allow the water to go through, will it remove all the dirt? And we all agree to say no. So this is because water is really good. It helps your body. It helps your body to clean. It helps your body to also maintain a low level of, a very low level of toxins that then allows your body to also reduce the toxin levels and then also try to heal itself. But this is where you need things like aloe vera. So some people are able to harvest this for themselves. And you find that in this case, the aloe vera that I take is 99.7. So it's pure. And that means that obviously it's a bit bitter, but it is something that actually helps. You actually see that even the moment you take it, it normally gives you like a running tummy within like the next hour. It totally cleans everything out, right? So it also comes in other flavors as well, like the aloe berry nectar. So if there's anyone that is a fan of cranberry juice, you actually realize that there's a lot of advantages that come with things like cranberries. And this is because the cranberries have got high levels of antioxidants. So when we spoke about antioxidants, we said your antioxidants, they help you to neutralize the effect of free radicals that would in turn affect your normal, healthy body cells, right? So it's a superfood filled with, so in this case, there's the flavor that is berry nectar that is actually filled with cranberries and aloe to try and help you, give you that high levels of antioxidants. So you'll find that this one, the aloe berry nectar actually helps a lot of women when it comes to hormonal balances, when it comes to cleaning the reproductive system, because it not only cleans, but it's actually helping you with the antioxidant levels as well, which is shown to be 20 times higher, than the vitamin C. And also, there's a lot of added advantages that come to it. So I'm not going to go much into this because there are quite a lot. Then you find that when it comes to weight loss, so weight loss, sometimes you might see that you keep going on diets, you stop, you're going to diet, you stop, you're going to diet, you stop. It's not because you're doing it the wrong way. And it's also not because, it's your body is just not responding. But the reason why your body is not responding is because, remember, we spoke about the hormonal imbalance, and then we also spoke about the state of your gut health. So sometimes you might actually be saying, no, I'm eating less food, I'm doing this, but I'm not losing the weight that I want to lose, right? This is because your gut health needs to be healthy first for you to actually feel the impact. So when your body then takes in the nutrients that you're taking in, if you're going to be eating more vegetable-based foods, your body should be in the right state to actually absorb the nutrients and not go into a starvation mode where it is harboring each and everything that you eat, as well as your hormones need to be in a balanced state for you to be able to say, for it to not be producing, high levels of estrogen that results in, the lower belly fat or the underarms and things like that, or high insulin levels, where your body is not regulating the insulin that is in the body, and then now you're actually resulting in producing more fat cells. So you find that these are some of the ladies that decided to say, okay, I want to go on this journey and try to regain the health of my digestive system and be able to lose certain weight. Sometimes, especially after childbirth, it's not easy to say that, it's not easy, not for everybody, to actually then be able to be in a position where you lose all the weight that you've actually gained, because during pregnancy normally people gain 20 to 40% of their natural weight. And so these are some of the ladies that decided, this is before and after. And then this lady in mustard and the black and gray, her name is Dr. Elizabeth Riwa. She's a medical doctor, and she's actually one of the ladies that I'm actually working with when it comes to women's awareness, when it comes to health. And this is herself before and after childbirth. So you'll find that there's a lot of things that are there. There's a lot of things that one can take. So all this, what it does, this weight loss program that I was showing here, is just, it allows your body to be cleansed enough to allow your body to then start burning down cells that are the fats that you actually have, because this is where you realize that if any one of you have ever looked into the skin tissues, just diagrams, when someone has a lot of fat on their lower belly, it actually comes to become a very thick layer that is just fat cells, nothing else. So these are some of the things that one can be able to look at. Once you decide, then you can also maintain to say, be active, to allow your body to actually then burn down those cells, because it requires energy. So that means then when you're now active, you actually then get to see the difference. So you find that obviously the weight loss is not an overnight weight loss, because your body actually needs time to understand that we are losing weight, but at a regular interval. There's no one, there's no thing that one can say, I'm going to do to lose weight overnight, or in the next 3 days I'm going to lose 10 kilos. No, you actually lose weight in a regular interval, or else your body actually goes into shock as well. So there's a lot of things that are there. There's also one that one of the people that I have decided to, okay, I'm just trying to move, I don't know why. Okay. There's also what is called Vitalize for Women. This is one that actually is a dietary supplement that just helps women with the reproductive system and hormonal support, a healthy menstrual flow, and things like the nervous system, immunity, skin, and iron absorption. So you'll find that iron absorption is very important, because we normally, especially if you're still going on your periods, you lose a lot of blood. So you find that iron absorption is really, really important. It also gives you the calcium, absorption support, and all these other things like vitamin B2, B12, vitamin C, D, and E. So there are a lot of things that are there. And remember, we also spoke about how sometimes as women, you end up losing interest in sexual activities, or sometimes you're just constantly fatigued, constantly, we're having high levels of anxiety, high levels of depression, all those things. So you find that there's this one called Multi-Maca. Multi-Maca, actually, I have a lot of people that have spoken to me about this. Maca is a natural herbal, let me just say herbal vegetable, or rather, I can't say it's a fruit because it doesn't have any. Let me say, so it's a natural herb that actually helps. We call it a superfood because it helps with not just your increasing sexual desires, but it actually helps with your hormones. It prevents yeast infections. This means that it's actually helping you to maintain your natural flora. It also restores the vaginal fluid that one is supposed to have, because normally sometimes women end up suffering from vaginal dryness, and vaginal dryness is actually just one of the side effects of birth control, because that hormonal imbalance then also results in vaginal dryness, and then also lack of sexual interest. So it's not something that you just decide to say, I don't want anymore, but it's just as a a result of, you know, what you're already taking into your body, or just due to stress. So maca also counters stress. It helps with regulations of your hormones, supports hormone production, and relief from fatigue. So royal jelly, this is something that I actually really like. This is something that I actually get to use every day. And the reason why I specifically use royal jelly every day is because it gives you high levels of nutrients, healthy skin, you know, nails, and it just allows your body to rejuvenate. So the reason why I'm saying skin and everything is because your nails and your hair, that is, those are dead cells that your body is producing. So you find that the nourishment of all those things, it's a certain there's certain what we call micronutrients that you need to have. So you find that there's certain people that, you know, like their nails, they don't grow anyway. They look like it's half, like it's cut into half or something, but it's actually, that's the full growth of their nails. Or, you know, some people start losing hair and things like that at a very young age. So royal jelly is something that is I actually use for that, because it gives you a lot of micronutrients that you wouldn't get from, you know, all these other normal and you know, food that we eat. Then some people actually also then refer to the royal jelly as, you know, the fertility food, because royal jelly is actually really helps you know, for when it comes to fertility, because it increases libido. It actually also supports egg and sperm production and health, because it's one thing to actually produce eggs, and actually it's one thing for a man to say that they do produce sperms, but then it's another to actually have a healthy reproductive system that produces eggs that are of the right health, or sperm that is actually vital. We call it vital sperm, that can actually has a certain level of movement, or, you know, the lifespan that it actually has for it to be able to survive in order to fertilize. So this has actually helped a lot of people, because sometimes when a woman struggles to have children, the woman is normally blamed for it, but it does not necessarily mean that always it's the woman. It's not always the case. Sometimes men actually, due to the, you know, things like using things that have normal things like laptops, putting laptops on their legs, you know, the food that they eat a lot of red meat instead of white meat, which actually supports the production of healthy sperms. You find that sometimes then women go through a lot because they're struggling to have kids, but it actually might not be their problem. So having things like royal jelly, where both of you as partners can be able to take omaka, it actually has helped a lot of women to actually then have children that they actually thought they wouldn't have, you know, without trying to drag the men to say, let's go to the doctor, let's go and get you checked, let's go and do this, because some men might not really necessarily agree to that. So here I'm just sharing that this is someone that was talking to me to say, you know, I've been blessed with twin girls at the age of 38. I'd given up, all thanks to the 3 bottles of berry nectar that I took, and multi-maca, the fertility product worked for me. So these are some of the things that, you know, some people then get to just experience. So well, I'm not saying that the moment you take these supplements, then yes, you're going to have kids. Yes, you're going to, you know, like forget about infertility. What I'm saying is that it will help your body to normalize, for your hormones to get balanced enough for you to actually then be in a position to conceive, if you're meant to conceive, you know. So there's a lot of things that are there. There's also Actic C. I absolutely love Actic C. This is something that I use myself sometimes, as well as for my parents. So Actic C improves your cardiovascular health. So you find that sometimes the older you get, your cardiovascular health also gets strained. Remember, we spoke about weight gains. We spoke about all these things that strain the heart as well. Sometimes it can also just be because your heart muscles are getting weak, right? So you find that the Actic C has got high levels of omega-3. So omega-3 enhances your immune response. This is within your body. It also supports your joint function, mobility, and proper vision as well. It also helps a lot even with memory, and, you know, it prevents skin wrinkling. So a lot of women actually take omega-3 products to try and help, because these are the natural, you know, dietary supplements that actually help your body to help itself, as we said in the beginning, to be able to maintain that livelihood that you wanted to have. And it also reduces cholesterol levels. So cholesterol levels, this is where even sometimes you can be very small, and have high levels of cholesterol. So you might actually be like, no, but I'm not fat. I don't consider myself fat. I don't consider myself obese, but you might actually have high levels of cholesterol. So these are some of the things that would need to get checked. There's natural antibiotics that fight colds and flus and infections. Then you also have things like B propolis. It's a chewable tablet, basically, that is just produced from propolis that allows your body to have that natural defense versus things like influenza. So this is a lady. Her name is Rafi, and she, at her young age, she found herself with an issue of fibroids. As you can see, she was very young, and she then decided to say, she had two fibroids. One was 3.5 centimeters, the other one was 7 centimeters. So she decided to say, the doctor had actually said that, you're going to need to undergo some surgery, but because she's very small, you need to actually then increase the amount of blood circulation that you have, because currently it's very low. So we all know that sometimes there are certain people that go into surgery, but then if your blood levels are low, now you're going to need blood donation, because you lose a certain amount of blood during surgery, and you need to be in a position where your body can quickly replenish that. So her blood levels were very low. Then they said, so you need to take some time to try and go on iron tablets, go on this for you to increase your blood level. So she then decided to say, I'm going to go on this range of supplements. And then this actually then helped her, because the fibroids, then the one that was 3.5 centimeters, it actually reduced until she managed to pass it out. And then the other 7 centimeters one started reducing. And in that case, she then managed to go back for her checkups and then be able to continue with her supplements until the fibroid had actually then diminished. So this is not something obviously that is going to happen for someone that has, like the big size of the fibroids that I was showing. So the only thing that one can do is to try and to make sure that you balance, you have a balanced, reproductive system as a woman, to try and avoid getting into scenarios like this. And if you do, it's better to try and make sure that you constantly go for a checkup, and make sure that if there's anything that is detected, it is still within its early stages, for you to be able to have a certain level of control over it, right? So, and this is after the fibroids were gone. She managed to have 2 kids after this, and we all know that fibroids, they also then result in issues with fertility. So you find that once the fibroids were gone, she managed to have 2 kids. So I'm also going to just touch on menopause. So it's also possible to go through a happy and healthy menopause, because anyway, it is a stage in life that we all go to. So you find that cranberry or anything that is got to do with royal jelly, soy protein, fish oil, and vitamin C will be really healthy, to help with menopause. So there are so many things that one can do. It comes to things like joints and muscles and things like that. This is when your body has got low calcium levels. And sometimes it's not just about calcium levels, it's because as we gain weight, you will see that the bone on your knee, you can hardly see it. This is because there's so many cells that are building up in your body, to the extent that you're actually putting so much pressure every time you're standing, you're walking. There's so much pressure on your joints, because of the weight gain that we normally experience as women. So you find that you can be able to supplement that calcium for you to be able to make sure that your joints are actually still maintained in a good state, while you're trying to see what else that you can do within your life to change your lifestyle. And because obviously these are things that we're not saying that you just do for 1 month. You need to, healthy living is a lifestyle. If you decide to say, I want to I like using weight loss, because it's something that I feel like a lot of women are affected by it, because it also affects things like your confidence. It affects how you feel. It affects how you feel even in your own clothes. It affects how people work. It affects people's mental health. And especially if everybody around you constantly says, oh, wow, you've gained weight. It's something that people can laugh about, but at the same time, it affects a lot of women. And it's something that is also within a lot of women. It's out of their control, because you are going to go through childbirth, you are going to take birth control pills. There's nothing that you can do about that. But then now all these other things, then the changes then come through. So these are some of the lifestyle changes that we need to make. So it's not that you have to make drastic life changes, but at least try and make one healthy choice every single day, until it becomes who you are and how you live. for you to actually then maintain it, and not just, to say that, because I've got a lot of people that will say, I lost so much weight, but then I didn't maintain it. For you to maintain it, it means it has to be part of your lifestyle. So there's also these that I love. It's super greens. Super greens is just basically trying to get all the nutrients that you'd get from normal healthy vegetables, and this is where you just get them from it's small sachets that you put in water, and then it just produces this green juice that you can drink. So this is something that anyone can actually take. So normally, especially for kids, we give them the super greens, because kids normally don't really consume everything that they're given on the healthy spectrum of food. So when it comes to your skin tone, and also things like yeast infections, and things that you want to avoid, aloe vera jelly is really good. So it tries to, like I was talking about vaginal itchiness. If you're feeling itchy on the outside, this is something that you can slightly apply on the top, and then it actually then helps you to just give that relief on the skin. And you also find even that those pimples that we normally get as women after you shave, you stop getting that once you start using the aloe vera jelly, that you just put it lightly, or you can even wash with it on the outside, right? So there's a lot of things that one can be able to say, this is what I want to do. But above all, I want to just say, as ladies, we are the strong people. We are the people that are considered as the weak vessels, yet we are the strong people. We are the people that actually then love, and extend love to each and every person around us. So I just want to remind you to say, remember to have time to love yourself, and try and make sure that you go for frequent medical checkups, have your own doctor that you go to, try and make sure that you get your checkups done. Remember, from what I said, if you haven't been checked for cervical cancer, go in, get that checked out and ruled out, whatever it is, just try and make sure that you are in a good state, because when you are healthy, then you can also be in a position to do more for yourselves and for your family. Your health is an investment, it's not an expense. So you'll find that, like changes to your lifestyle, your food, and what you take into your body, your dietary supplements. Sometimes we might actually consider it as an expense, but only when it comes to a point where your health is actually now at a point where it's really bad. For me, in the medical field, by the time I know that we need to get implants for somebody, or we need to get instruments for surgery, then that is now a big problem. That is something that, even the expenses are really bad. And, sometimes I get to be exposed to see a lot of people and patients that are actually going through the most, but the medical aid can't cover the needs that they have for the particular procedures that they need as well. So your health is an investment. It is not an expense. You need to incorporate it into as part of your budget. The same way, we get pads, we get tampons. We also need to look after our health as women. We also need to look after our reproductive systems. This is something that nobody else would understand besides us. So make sure that, this is just a reminder, love yourself, have some time for yourself, and, ensure that you put your health first. So thank you so much. Thank you so much. And let's get more women in touch. If you want to be part of my newsletter shares that I send out for ladies, please just reach out to me after this call, and then I'll save your number. You can save my details. And then because from time to time, I share some health awareness information that you can be able to use for yourself and for your families, even for back to school times when it comes to kids. In certain aspects of that. So thank you so much for attending. Thank you so much for the questions that I'm seeing in the chat. Feel free to also reach out to me personally. I'm actually seeing that there's some that I'd love to respond to. So I'm just trying to see if there's some that require answers right now. I'm seeing Chili saying, I can't do without multivitamins. This is amazing. I really love the fact that you're already looking into that. Sometimes I go on my period 2 to 3 times a month. Yes, I think we would have to talk more about this so that we can see the frequency. This is for Oguhle. And then we should normalize men sterilizing in marriages. Yeah, it's one of the things that people talk about, but well, there's nothing that we can do. We can't drag them now, can we? So there's so many questions that I'm seeing here, and if you didn't manage to also join at the beginning, I'll understand, and I'll be able to share the recording with you. And there's a lot that we can be able to talk about, and I'm going to be having these sessions quite frequently. So try and make sure that you get the details from the person that invited you. And let's grow as women. Let's bring more women to be aware, of our health, and, be the ladies that we want to be within our homes and in our lives. Thank you so much.